First up, some encouraging news. The government says there are early signs of cases plateauing in Delhi and Maharashtra. Mumbai on Monday logged 2,624 new COVID cases in 24 hours, registering its lowest one-day spike in over 5 weeks. The number of COVID tests also saw a sharp dip, however, from a daily average of 50,000 to 38,000 on Sunday, according to the official data. Now, the case count has gone down in Delhi as well in the last 2 days, but a much bigger concern in the national capital is the rising number of deaths. On Monday, Delhi reported 18,043 cases. That's the lowest cases since April 15th, lowest daily cases. And 448 deaths, however, were also reported. This is the third day that deaths have been over 400. So that remains a big worry for Delhi. And if we compare Delhi with Bengaluru, Bengaluru reported over 22,000 daily cases, while Delhi has reported 18,000 cases. It's day 2 that Bengaluru has been reporting more cases than the national capital. In Delhi, the positivity rate is 29.56%, while Bengaluru is 29.80%, so a little bit higher than in Delhi. Now, the tragedy is that Indians are dying across India, not just from the COVID disease, but also because of the lack of oxygen. There's a desperate cry for life-saving oxygen across the country. 24 patients died at a hospital in Karnataka, allegedly due to shortage of oxygen. At a hospital in Madhya Pradesh, relatives claim that 4 patients died as the hospital ran out of oxygen for half an hour. Officials, though, in Madhya Pradesh denied that there was an oxygen shortage. In UP, a desperate bid by sisters to save their mother, giving her mouth-to-mouth resuscitation. And in a bid to save their mother, those visuals are coming up. But despite these scenes, we just showed you what's happening on the ground and these deaths taking place inside hospitals due to lack of oxygen, listen to what the government is saying about oxygen in the country. They claim that despite the spike in demand, there is enough oxygen.
मैं सभी देशवासियों को आश्वस्त करना चाहूंगा कि ऑक्सीजन की मांग में वृद्धि होने के बाद भी देश में पर्याप्त मात्रा में ऑक्सीजन उपलब्ध है और साथ ही भविष्य में कोविड केसेस में अपेक्षानुसार कमी न होने अथवा वृद्धि होने की आशंका को ध्यान में रखते हुए भारत सरकार विदेश से भी ऑक्सीजन इंपोर्ट कर रही है जिससे कि भविष्य में भी यह पर्याप्त मात्रा में उपलब्ध रहे.
So government reassurances that there's enough oxygen, but on the ground people are dying, and not just outside of hospitals but inside hospitals. So let's first focus on Karnataka, where 22 patients died at a government hospital. The tragedy took place in Chamarajnagar. The deaths, the families say, was due to a drop in oxygen supply.
Tragedy in Karnataka's Chamarajnagar district, with 23 COVID patients dying at this government district hospital in less than a day. Relatives allege that a lack of oxygen caused at least some of the deaths. Rajana got an SOS call at midnight from his nephew, who had got married just a couple of months ago. The government has ordered an inquiry headed by an IAS officer on the deaths that happened between 9 a.m. on Sunday and 7 a.m. on Monday. The report should be submitted in 3 days' time. The hospital and authorities made efforts to meet the oxygen shortfall that occurred shortly after midnight.
ಇದು ಕೊರತೆ ಆಗ್ತಾ ಬಂದಿದೆ ಅಂತ ಗೊತ್ತಾದ ತಕ್ಷಣ ನಾವೆಲ್ಲರೂ ಕೂಡ ಡಿಸಿ ಎಲ್ಲರೂ ಕೂಡ ಪ್ರಯತ್ನ ಪಟ್ಟು 80 ಸಿಲಿಂಡರ್ಸ್ನ ನಾವು ಜಿಲ್ಲಾಸ್ಪತ್ರೆ ತರಕ್ಕೆ ಸಾಧ್ಯ ಆಯಿತು. ಮೈಸೂರಿನಿಂದ ನಮಗೆ ಈ ಸಿಲಿಂಡರ್ಸು ಸುಲಲಿತವಾಗಿ ಬರಬೇಕಾಗಿತ್ತು, ಅದು ಸ್ವಲ್ಪ ತೊಂದರೆ ಆಗಿದೆ.
The MP from neighbouring Mysuru district from the BJP says he organised over 15 cylinders.
ರಾತ್ರಿನೇ ಸದರ್ನ್ ಗ್ಯಾಸ್ ಏಜೆನ್ಸಿ ಅವ್ರನ್ನ ಕರೆಸಿ ಅವರಿಗೆ ಅಲ್ಲಿ 15 ಸಿಲಿಂಡರ್ ಕೊಟ್ಟು, ಅದಕ್ಕಿಂತ ಮೊದಲು 50 ಸಿಲಿಂಡರ್ ಪದಕ್ಕಿಂತ ಕೊಟ್ಟಿದ್ದು. ರಾತ್ರಿ 3 ಗಂಟೆಗೆ ಮತ್ತೆ 60 ಸಿಲಿಂಡರ್ನ ಕೊಟ್ಟಿದ್ವಿ, ಬೆಳಗ್ಗೆ 7 ಗಂಟೆಗೆ ಕೊಟ್ಟಿದ್ವಿ. ಇಷ್ಟಾಗಿಯೂ ಕೂಡ ಈ ಒಂದು ಅವಘಡ ಸಂಭವಿಸಿರುವಂತದ್ದು ಬಹಳ ದುರದೃಷ್ಟಕರ ಸಂಗತಿ.
The opposition Congress criticised the government over the deaths. Rahul Gandhi tweeted, "Died or killed. My heartfelt condolences to their families." Karnataka has been struck hard by the second deadly wave of the coronavirus. In this district, cases have shot up by almost 4,000 in the last 2 weeks. This has strained medical infrastructure. And now this loss in Chamarajnagar, leaving so many grieving families. Maya Sharma for NDTV.
And the same story of struggle and desperation in Madhya Pradesh, where 4 COVID patients died at the district hospital in Barwani due to problems with the oxygen supply. That's what their families have alleged. The district authorities, however, while admitting that there was a glitch in the oxygen supply, said only one person died, and that too of a cardiac arrest.
Seen inside Barwani District Hospital ward in Madhya Pradesh, where oxygen supply reportedly became low for half an hour and pushed patients into distress and attenders into a panic. Relatives claim 4 patients had died.
सिलेंडर ऑक्सीजन लाइन बंद हो गया था, कम से कम आधे घंटे तक ऑक्सीजन लाइन नहीं चला और ऊपर मेरा पेशेंट उसी की वजह से एक्सपायर हुआ है.
मेरे बच्चे की सुबह से 94 ऑक्सीजन चल रही थी, एकदम से ऑक्सीजन बंद हो गई. आधे घंटे तक अफरा तफरी मचा करी हम बोला करे कि ऑक्सीजन चालू करो. मेरी गोद में मेरा बच्चा ऐसा तड़पा करा. ये इन लोगों ने कोई डॉक्टर नहीं और कोई नहीं, हमको यहाँ पर किसी ने हेल्प करी.
Even as anxious relatives vented their emotions, the district administration claims not 4 but 1 death had happened due to cardiac arrest.
जैसे ही शिकायत प्राप्त हुई तुरंत जो हमारे ऑक्सीजन मैकेनिक है उन्होंने 5 मिनट के भीतर आके उसको देखा और फ्लो को जो है नॉर्मल उसमें फ्लो को रिस्टोर किया. तो ऑक्सीजन का फ्लो कम होने से किसी प्रकार की कोई कैजुअलिटी नहीं हुई है. एक परिजन जो कार्डियक अरेस्ट थे, जो आईसीयू में थे, कार्डियक अरेस्ट से एक परिजन की मृत्यु हुई है.
ये हॉस्पिटल की लापरवाही, गैस का सिलेंडर तो लगा दिया, इसमें गैस ही नहीं है, देख लीजिए क्या पापा.
In this video from AIIMS in Bhopal, a young man says his father was fitted with an empty oxygen cylinder, nearly causing his death. A probe has been ordered into why and how that happened. With inputs from Barwani and Bhopal, Uma Sudhir, NDTV.
And what could add to the worries of COVID-hit Punjab is that it's witnessing a sharp spike in deaths this year. The government data has revealed that the case fatality rate is far more in rural areas than in the urban population. Also, there's a big resistance against the testing as well as vaccinations. Mohammad Ghazali reports.
In the rural areas of Punjab, more COVID patients are dying compared to urban areas, according to the government. It's 2.8% in the villages against 0.7% in urban areas. Here in Mansa, deaths have gone up by almost 25% in a month. As per Health Department data, the district reported 4 deaths in the last 3 days, but data from one crematorium of the district suggests otherwise.
कल अपने 5 आ गए जी, परसों 4 आए सीगे, अज 3 डेड बॉडियां आ गई. एक दा मैसेज आया लकड़ा तैयार कर लो जी. शाम हजे पई है, कोई पता नहीं गई.
Mansa is also the epicenter of many farm agitations. Though gathering of people is restricted due to COVID, but such sites are common in several districts.
टेस्ट विरोधी मीटिंग की है, लोगों ने फैसला लिया है कि सरकार या पुलिस प्रशासन लोगों का जबरी कोरोना टेस्ट करूगा तो यह सहन नहीं किया जाऊगा. सरकार नूं साडी चेतावनी है, पुलिस नूं चेतावनी है.
The government says there is a resistance against tests and vaccination. Overall this year, till mid-April, 3 of every 5 COVID deaths happened in rural Punjab, even though the positivity rate is much higher in the towns.
ਦੂਜੀ ਗੱਲ ਇਹ ਹੈ ਕਿ ਸ਼ਹਿਰਾਂ ਦੇ ਵਿੱਚ ਜਿਹੜੀ ਵੈਕਸੀਨੇਸ਼ਨ ਹੋ ਰਹੀ ਆ ਉਹਦੇ ਪ੍ਰਤੀ ਵੀ ਲੋਕਾਂ ਦੇ ਵਿੱਚ ਬਹੁਤ ਅਵੇਅਰਨੈਸ ਹੈ ਕਿ ਵੀ ਉੱਥੇ ਲੋਕੀ ਵੈਕਸੀਨੇਸ਼ਨ ਵਾਸਤੇ ਲੈਣਾ ਲਗਾ ਕੇ ਖੜਦੇ ਨੇ ਕਿਉਂ ਚ ਖੜਦੇ ਨੇ ਕਿ ਸਾਨੂੰ ਪਹਿਲਾਂ ਵੈਕਸੀਨੇਸ਼ਨ ਲਗਾਈ ਜਾਵੇ ਪਰ ਮੈਨੂੰ ਉਦੋਂ ਅਫਸੋਸ ਹੁੰਦਾ ਕਿ ਜਦੋਂ ਸਾਡੇ ਪਿੰਡਾਂ ਦੇ ਵਿੱਚ ਕਈ ਗਲਤ ਅਨਸਰ ਜਿਹੜੇ ਰਿਊਮਰ ਫੈਲਾ ਕੇ ਲੋਕਾਂ ਨੂੰ ਇਸ ਲਾਉਣ ਤੋਂ ਪਰਹੇਜ਼ ਕਰਨ ਲਈ ਕਹਿੰਦੇ ਨੇ
In Mansar district, now police are trying to motivate the rural population to get tested and vaccinated.
ਜਿਹੜੇ ਵੀ ਮਤਲਬ ਆਪਣੀ ਯੂਨੀਅਨਸ ਹੈਗੀ ਐਸੋਸੀਏਸ਼ਨਸ ਹੈਗੀ ਉਹਨਾਂ ਨੂੰ ਕਹੋ ਕਿ ਭਾਈ ਆਪਾਂ ਮਤਲਬ ਸਖਤੀ ਨਾਲ ਪਾਲਣ ਕਰੀਏ ਪਹਿਲਾਂ ਖੁਦ ਦੀ ਸੇਫਟੀ ਵਾਸਤੇ ਪਰਿਵਾਰ ਦੀ ਸੇਫਟੀ ਵਾਸਤੇ ਜਿਹੜੇ ਗ੍ਰਾਹਕ ਹੈਗੇ ਉਹਨਾਂ ਦੀ ਸੇਫਟੀ ਵਾਸਤੇ ਮਾਸਕ ਪ੍ਰੋਪਰ ਲਾ ਕੇ ਰੱਖਣਾ ਹੀ ਰੱਖਣਾ.
Punjab is facing vaccine shortage and many patients from the NCR region are also moving towards Punjab to get ICU beds and oxygen beds. Amid all this, the resistance from rural areas is going to be a big challenge to contain the spread of coronavirus. With Bhupinder Khalsa in Mansa, in Chandigarh, Mohammad Ghazali for NDTV.
Now, the Delhi government has sought the army's help and a defence ministry-style hospital to deal with the raging COVID crisis in the city. Writing to Union Defence Minister Rajnath Singh, Delhi Deputy Chief Minister Manish Sirkar said the Indian Army has always stood at the forefront during every time of crisis. I shall be grateful if your ministry could lend the services of the armed forces to set up, operationalize and run some COVID health facilities with about 10,000 oxygenated non-ICU beds and 1,000 ICU beds. Meanwhile, the Oxygen Express is set to deliver its biggest single-day load of nearly 205 tons of oxygen to Delhi by Tuesday morning. The 20 Oxygen Express trains have completed their journey across India, delivering 1,125 metric tons of liquid medical oxygen in 76 tankers. Welcome back. Now our continued focus on India's healthcare crisis, and now healthcare workers are overwhelmed. Speaking to NDTV, Pritha Reddy, Executive Vice Chairman, Apollo Hospital, said they even have 2 youngsters between the ages of 30 to 40 years who are battling for their lives.
First up, and I must confess, I've been discussing, the fallout of COVID on a daily basis almost. We just don't talk about doctors enough. We interview doctors but don't talk about what's happening to them in hospitals, or frontline healthcare workers, or janitors, or nurses, or sanitary staff, or even cooks. These are people who make up the heart of your team. Can you tell us what they are doing to keep people alive now?
Thank you, Vishnu, and I'm, appearing here on behalf of 60,000 plus of Apollo staff and the entire country's healthcare workers. As we speak, in one location, I have 2 youngsters who are, between 30 and 40 years of age, who are literally battling for their lives, healthcare workers, frontline workers. And I mean, the whole organization is praying that they will come out of it. They're on the ventilator. They've had the best-in-class treatment. I have a young doctor here who hasn't gone home to see, he's had a baby, 4-month-old baby, and the only time is FaceTime. So, they talk to each other on FaceTime, but he says, no, this serving people or working in the front lines is more important. I will get some time off to be with my little child. There's a girl from Kerala, father died 2 weeks ago. She hasn't gone home because she feels, she's needed here. So I think the healthcare workers really, really have to be acknowledged within our country, outside our country, because everyone is literally working in the front lines. And to me, thank you, gratitude, whatever we do for them is just not enough. It's like there is so much to be done and to be thankful for. So the public at large is at risk, including our healthcare workers for sure. We as an organization have set up, quarantine facilities purely for our own staff and our workers because they need it, and we're able to give that to them. In the event of they need care within the hospital systems, they have beds and they will get the best in class whatever is available, because I think they deserve it. They're like our family. But just scaling up is what we've all been focusing on. You know, we've tripled the number of ICU beds in each one of our hospitals. And, you know, we're talking about 70 hospitals and each one of them has ICU COVID beds. We've got AI, which is, again, a very innovative model done by my sister, where people can actually check into a hotel to quarantine themselves and they will be monitored real time with technology and nurses. So that is happening. Apollo 24/7 is providing, again, 24/7 care for people at their homes whenever they need and consultation. So at any given time, Apollo as a group, today's number is 14,080 people being looked after, you know, throughout. We can do much more. We need to do much more. I'm not, you know, applauding ourselves. I just feel that we have to come together to do that. That's what I really feel.
So let me ask you a little bit about the government's plan to bring in final year medical students. It seems to suggest that, you know, people are falling ill or we need more healthcare workers. What are your thoughts? These are all young kids in a sense, final year students still under supervision, being brought into a war zone. Your thoughts? I mean, I don't have a specific question on this.
So frankly, Vishnu, we don't have an option. Both final year nurses, final year medical students and skilled workers in the healthcare space are really required. What we need to do is to give them proper protocols, give them like a mentor or guide. So typically there would be one experienced doctor and under him 10 of these, because, you know, the bedside care, a lot of stuff, entry into the computer, a lot of stuff which, you know, can be done by somebody who's just intelligent and who's trained to this level. That load can be taken off from the more skilled people. So I think we need to do different layers and levels of skilling and get more people on board, because honestly, frankly, we don't have an option. So I think the policy decision to allow, you know, the final year students to come and work on the front line, the policy decision to move NEET by 4 months, to reward people who've done more than 100 hours of COVID duty, all this are steps in the right direction, because it really motivates people. It motivates the frontline workers who are tired. You know, they know that at least somebody is giving them reinforcements. We ourselves from our medical schools have mobilized 2,000 people from our nursing schools and medical schools.
And are they enthusiastic? They want to get in over there, get the experience?
They're very enthusiastic. You know, they're like passionate, they're young, they really want to make a difference.
Welcome back. News now from West Bengal. And West Bengal governor met with Mamata Banerjee a day after her massive victory in the assembly election. She will be sworn in as chief minister on the 5th of May. It will be a small ceremony at the Raj Bhavan. She will be sworn in alone on the 5th, and the council of ministers will be sworn in on the 6th, the day after. Now, West Bengal has reported several incidents of post-poll violence, so much so that the BJP has called for a dharna now over the violence. 4 people were allegedly killed in clashes between the Trinamool and BJP in West Bengal's Purba Bardhaman district after the election results were announced. The Trinamool Congress has claimed 3 of its supporters were killed by the BJP, which rejected allegations. Well, let's go across to NDTV Saurabh Gupta now for more. And Saurabh, there are a lot of allegations and a lot of, you know, BJP personalities also tweeting and talking about the kind of violence that is taking place in West Bengal and claiming that many of their supporters are being targeted, houses are being burnt, and now a dharna has also been called.
Absolutely, you know, unfortunate incidents of political violence, and there is no denying that violence has taken place, and something that perhaps the administration should have taken note of and tried to diffuse and not let these incidents happen. Now, what has happened is that, you know, Mamata Banerjee has appealed for calm. But Trinamool sources explain that, look, the administration is not in her hands at this point. She's not yet been sworn in as Chief Minister, and the administration rests with, the officers, the police officers appointed by the Election Commission during the election period. That's one thing. Now, both sides are claiming that their workers have been, killed. Meanwhile, I spoke to several left leaders as well. The left leaders are saying that, look, one autocrat has reigned over another in this election. That's on record from the left's Manoj Bhattacharya, who's the RSP leader. And he said that these incidents of violence are reminding people of the kind of violence the left supporters faced in Tripura after they were routed there. In the elections with BJP won. So the left is saying that this is just the complete polarization in Bengal, and the two parties are indulging in this violence against each other. But the governor has asked for a report on the violence, and both parties, the left, the Trinamool and the BJP, are claiming. The BJP says that their workers have been killed. The police administration, I believe, have actually sent a report to the Home Secretary. The MHA, the Ministry of Home Affairs, has asked for a report, but unfortunately political violence has been a part of elections in West Bengal, and that's something that is tragic, and that's something that unfortunately continues, even in the present day. Every election in Bengal has been marred by violence, and usually the responsibility of ensuring law and order is with the party in charge. In this case, the party that has won these elections is the Trinamool Congress. But the Trinamool Congress sources are explaining, look, the administration is not with us. The EC has changed officers during the election. The EC has appointed officers during the elections. And, so how can one hold us responsible for the administration at this point? That's the question that Trinamool is throwing. Meanwhile, JP Nadda, BJP president, is going to be here holding a nationwide dharna. He lands in Kolkata today. Tomorrow is Mamata Banerjee's swearing in, and it'll coincide with JP Nadda's leading the dharna. A lot of people are actually upset about the violence. Even on Twitter, several parties that have congratulated, Mamata Banerjee. For example, the Shiv Sena has also asked, why is this violence happening in West Bengal? And unfortunate it is for sure. And both, unfortunately, again, it has been a part of elections in West Bengal, and that's something that the administration definitely, no matter who's in charge, needs to take note of immediately.
In news just coming in, the SOS for oxygen from Delhi hospitals continues. Now the Triton Children's Hospital says it's left with just 2 hours of oxygen. Let's go across to NDTV's Meher for more on this. Meher, what are the details?
Yes, Karji. So Triton Hospital is a children's hospital in Kalkaji, South Delhi, and they have less than 2 hours of oxygen left now. They're on their last cylinder. They also sent out an SOS at 9 p.m. last night. They got some cylinders to last through the night, but again, they are in a crisis situation, left with their last cylinder. So it's important to remember that this is a non-COVID hospital, but obviously there are also oxygen is needed for non-COVID reasons. So there are 10 children on oxygen support here, 6 on ventilator, which is high flow, and they need a lot of constant oxygen. And because of long lines at all the oxygen cylinder refilling centers, they have now not been able to get their needed supply. They are left with 1 cylinder only, which will last them 2 hours.
Right. So, Meher, you're telling us they did receive, some sort of help in the course of the night, but even now they still remain in this crisis. And we do know that the Supreme Court had told the centre that by Monday midnight, Delhi should get its adequate supply of oxygen, and we shouldn't have this situation anymore in which hospitals are forced to send out these sort of appeals, this SOS, and, be totally on the brink in terms of their oxygen supply.
Yes, exactly. This is a situation that has been happening for so long, and there was a small reprieve the past few days when Delhi received close to its allocated supply. Their allocated supply is 490 metric tons. They received around 450, 445 the past 2 days. But again, smaller hospitals which don't get tankers but rely on cylinders are left struggling because lines at cylinder refilling centers are still very, very long.
All right, Meher, thanks so much for joining us. So that is the news coming in. Another SOS from a hospital in Delhi. This time, as Meher was telling us, the Triton Children's Hospital, which says it's left with just 2 hours of oxygen supply. Now, this is a non-COVID children's hospital, and at least 10 children in the hospital are on oxygen support. 6 of them are on ventilators. So an SOS was sent earlier from this hospital. They did receive some sort of support, but now again, they have just 1 cylinder left is what they're saying, and just 2 hours of oxygen supply, and children's lives in danger. So the situation in Delhi continues with hospitals sending out SOS for oxygen. Now, India in the grip of the second wave of COVID, the ferocity of which has taken the country by surprise. We spoke to Dr. Madhukumali Vijaya Sures, the distinguished professor at IIT Hyderabad and head of India's COVID modelling committee, and asked him how much did our data crunchers and modelers know about the impending second COVID surge.
Thank you, sir, very much for being with us. When did you know that India was facing a second surge?
So, I think generally everybody, the government and the scientific community, they knew that cases were beginning to rise. If you look at, for example, the number of cases in the state of Maharashtra, already by the first week of March, they were showing a very clear upturn. And at that point, we could not make a quantitative prediction. See, it's one thing to say cases are rising, anybody can say that. But to make a precise estimate of, pardon me, make a precise estimate of when the cases would peak, what the peak might be, we did not have enough information at that point in time to make a reliable prediction.
So what was your prediction? Professor Vijaya Sures?
On April 2nd, I'm coming to that. So that's when we formally made a prediction, April 2nd.
What was your prediction at that stage based on incomplete data?
Okay, so that's a very good question. There are 2 aspects to the prediction, right? One is what is the predicted peak value, and the other is what is the predicted time. Do you understand?
Yeah.
When will the peak come and how high will be the peak? And both are equally useful because the predicted peak that we showed to the government was very low. It was off by quite a bit. We said somewhere around 1.2 lakhs would be the peak. And you know as well as we do, that was quite badly off. However, the timing that we had predicted was around May 15th to the 22nd for the peak. And if I may, I'll just explain why that piece of information is important. Because there were some plans afoot at that point in time to bring on stream some solutions that may take, let us say, 3 months, 4 months to fructify. And we wanted to convey the message that no, we don't have that kind of time. Whatever we do now, it has to pay off in the next 4 to 6
So, Professor, just so that I understand you, in the month of March, you had data, albeit incomplete data, which you gave to the government with the submission that things needed to move right away.
No. That is, I'm sorry if I didn't explain correctly. I said that the data was available to everybody. They could see in the month of March, already the curves were rising, you can see. But that was not enough to make any kind of a reliable prediction. So the first formal presentation we made to the government was on April 2nd.
Okay.
Where we went with some sort of a quantitative prediction, which was pretty accurate in terms of the timing of the peak, but quite incomplete and inaccurate in terms of the value of the peak. And if you have been following our tweets,
I've been following this very closely. But my question is, in the beginning of April, when you did go to the government formally with a certain number and with a certain date, when we were looking at early May for this to peak, what was the response of the government then?
Yes, okay. So just to clarify a small error in what you've just said, when we went to the government on April 2nd with our quantitative predictions, we had predicted a peak of between May 15th to May 22nd. And if you have been following our tweets, we have actually brought the time forward, and we're saying that the peak is going to be in the next week or so.
Yeah, around the 4th of May.
Yeah, exactly. That's exactly what we're saying. So, and part of the reason for the peak coming forward is because the cases have been climbing more steeply.
No, Professor, I understand that, but I'm asking what happened when you, on the 2nd of April, went to the government formally and said the numbers are fairly large and the peak is going to be in the first week of May. How did they respond to you?
Oh, yes, that's a very good question. So what happened was that some of the focus shifted from long-term measures and medium-term measures to short-term measures. That is, bringing a bunch of beds on stream right away, making plans for oxygen supply, all these kinds of things that had to be done on a war footing. I'm not by any means saying that we were the only ones to flag this, but we were amongst the ones to flag that there is a need for an immediate response. And you can see that they did respond pretty quickly on
So,
that.
Professor Vijaya Sures, in the 2nd of April, when you went to the government, did you project that by the 4th of May, a total number of active cases would be as high as 33 to 35 lakhs?
No. What we actually projected on April 2nd was that the peak would be around 1.2 lakhs. No, sorry, you're talking about active cases. So active cases we projected around 15 lakhs and new daily cases around 1.2 lakhs. And the peak we projected was around the middle of May.
You were, so that's interesting. More than 1 lakh daily additions is something that you had predicted in the beginning of April.
That's right.
But sir, that is a staggering number.
Well, that was the peak that we had predicted.
And I appreciate that. But if in the beginning of April, right, and now we are in May, you had predicted that in a finite period of time, we would be hitting more than 1 lakh cases a day. How did the government take your advice seriously?
I think they did take the advice very seriously, because what happened was that a lot of the efforts that the government was making were reoriented from medium-term measures, which might have paid off in, let's say, 2 months' time, to very short-term measures that would start paying off very quickly in 2 to 3 weeks kind of a time period.
But have any of those measures worked, sir?
Well, I think that I leave to you, the journalistic community.
So that's not your domain, I understand that. But epidemiologically, and if you look at trends, and you look at the United Kingdom, it took 3 months of a lockdown and an incredible vaccination drive for the United Kingdom to beat the strain of the virus, which is believed to be circulating one among a few in India. If in the beginning of April, you sounded an alarm saying we are going to be hitting 1 lakh cases, and with the benefit of seeing what happened just a few months back in the United Kingdom, how can you say the government has done enough to react to your information?
See, the reason why I say that is because let us understand that in the UK, they in fact, during the first wave, did not take any countermeasures at all. They kept restaurants and bars open.
Yes, and we know how they suffered.
Yeah, exactly.
Right.
So now, because of that, the failure to take adequate measures during their first wave, their second wave was much, much more intensive. And please remember also that they started their vaccination towards the end of their second wave. Whereas in our country, we started our vaccinations for the general public on March 1st, before the start of our second wave.
But Professor Vijaya Sures, this is the part I fail to understand. If on the 1st or the 2nd of April, you told the government that there were 1 lakh cases upon us on a 24-hour basis in a finite period of time, why did India not go in for a lockdown?
Because you see, a lockdown is a very blunt instrument. You know, actually...
And yet here we are, sir.
Yes, where are we? What I mean by that is, do you really think that where we are today, if we just lock down, we're going to get out of the pandemic? I don't agree with that statement. You see, if you remember what we did in the first round, we actually went for green zone, orange zone, red zone, highly focused containment measures. That is what is more likely to work. than a kind of a blanket lockdown.
So why was that not done why was that not done after you sounded out your report in early April?
Well, you know, that is not within our domain.
No,
That
but
is
sir,
how
as I understand it, sir, you are one of the foremost scientists in the country. You sounded out and you sounded out people in March, albeit with incomplete information. You had more information in the month of April, which you've just shared with us. And that information was more than 1 lakh cases on a 24-hour basis in a finite period of time. Was enough done? I mean, I think we can look at what the results there are right now. You can say, okay, the blanket, all India shutdown, not correct strategy. Whatever strategy, sir, micro-containment zones, red, orange, green, whatever it is, the fact of the matter is, with those numbers, have we done enough?
So I think that yes, let's put it this way. First of all, the magnitude of our second wave was higher than the magnitude of second waves in Europe, specifically Italy and the UK.
Yes.
And higher than in USA as well. So in terms of what we could do, so some of the measures that have been put in place, like making up makeshift hospitals. So for example, the armed forces have swung into action to put up hospitals in various places.
Sir, respectfully, Professor, people are gasping for breath in Delhi. The measures which have taken place are very small compared to the requirements, sir.
Well, I'm not disagreeing.
So, Professor,
with you
let's
on
stick
that.
to your area of specific expertise. And let's just look at, number one, if there is underreporting, as has been widely believed to be the case, then how do we know the true number of cases by the middle of May or a few days later in May who would have perished?
So that's actually a question that I've been waiting for somebody to ask me. You know, all these interviews I have given, nobody ever asked me, how do we as the modelers account for the difference between the reported number of cases and the actual number of cases? So the answer that I as a modeler would give is the following. Let us assume that cases are being underreported. And you would know that far better than I would because you're on the street, you're on the ground, and you know the situation. But the ratio of underreporting, if any, does not change from one day to the next. Do you understand my point? So if we predict the trajectory of reported cases, and that is beginning to show a downturn, which we predict at the end of this week, it's reasonable to expect that the actual number of cases, whatever that might be, would also show a downturn. Okay. The actual number of cases is very difficult to guess, but the reported number of cases is much easier to work with.
Right. All right, sir, we've run out of time on all of this, and perhaps we should talk again about the need for more data based on genetic sequencing and how that can actually serve your cause. We'll talk about that in another interview. I'd like to thank you very much, sir, for being with us out of time.
Well, it's always a pleasure to talk to you, and I look forward to being asked again all these questions. Thank you.
Right, sir. Thank you very much indeed.
Indians are dying across India, but not just because of coronavirus, but also because of the lack of oxygen. That's the big focus here on the program. There's a desperate cry for the life-saving oxygen across the country. 24 patients died at a hospital in Karnataka, allegedly due to shortage of oxygen. At a hospital in Madhya Pradesh, relatives claim 4 patients died as the hospital ran out of oxygen for a crucial 2 hours. Officials, though, in Madhya Pradesh have denied there was any shortage of oxygen. All right, so there you can see the kind of scenes are being played out across the country. And now in Delhi, another SOS from a hospital for oxygen. The Triton Children's Hospital is left with just 2 hours of oxygen supply is what they've said. And they have several children who are in ICU and on ventilator support, and they require that oxygen urgently. Let's go across to NDTV's Meher for more. Meher, what are the details? Is there any help coming to the hospital?
Kargi, so far they haven't had any leads. They've sent out multiple SOSs on Twitter. This is their second SOS in 12 hours. They got some help last night, but again, they are on their last cylinder now. So this is the neonatal ICU unit where premature babies are kept. So 10 are on oxygen support there and 6 are on ventilators. So they require high flow, stable oxygen support. And so far, they haven't had any leads. They got some support from the Delhi oxygen unit, but there wasn't that much support. They are again struggling this morning.
All right, Meher. So even now, this desperate situation regarding oxygen continuing in Delhi, and we do know that the Supreme Court had asked the centre to sort this problem out by midnight on Monday, that there should be adequate oxygen supply to the capital, because for the last couple of it's been 2 weeks, in fact, of this oxygen crisis in the capital.
Yes, exactly. So Delhi requires over 900 metric tons of oxygen, but it was actually allocated less than half of that, around 490 metric tons. But they actually get supplied even less than that. So many hospitals, especially smaller hospitals, are left struggling for oxygen every day.
All right, Meher, thanks so much for joining us with that. So yet another SOS being sent out, this time from the Triton Children's Hospital, that says they're running out of oxygen they needed urgently for the children in their care. Meanwhile, aid is arriving from abroad, and the 5th consignment carrying 545 oxygen concentrators has arrived from the United States. The 5th in a series of consignments carrying medical equipment arrives from the US. This one carrying 545 oxygen concentrators is the tweet by the MEA spokesperson Arindam Bagchi. Though many are asking where is this aid currently, because in the last couple of days the oxygen crisis is continuing, and there's no indication of where all this aid that has been coming in from various countries, from UK, US and from Russia even, has been going. Another flight carrying 282 cylinders, 60 oxygen concentrators, ventilators and other medical supplies has also arrived in India from Kuwait. Now, the government has claimed that there are early signs of cases plateauing in Delhi and Maharashtra. Mumbai on Monday logged 2,624 new COVID cases in 24 hours, registering its lowest one-day spike in over 5 weeks. The number of COVID tests, however, also saw a sharp dip from a daily average of 50,000 to 38,000 on Sunday. And the case count has gone down in the national capital as well over the last 2 days. But a much bigger concern in the national capital is the rising number of deaths. On Monday, Delhi reported 18,043 cases. That's the lowest number of daily cases since the 15th of April. But we also reported 448 deaths, and this is the third day that deaths have been over 400. And if we compare Delhi and Bengaluru, Bengaluru reported over 22,000 daily cases, while Delhi reported over 18,000. Day 2 of Bengaluru having more cases than the national capital. Also, the positivity rate in Delhi is 29.56%, very high still, while Bengaluru is slightly higher, 29.80%. Now, External Affairs Minister S. Jaishankar met the U.S. Secretary of State Antony Blinken in London in their first in-person meeting ever since the Joe Biden administration took charge in January this year. Both are in London to attend the G7 Foreign Ministers meeting, where India has been invited as a guest country. Good to meet in person my old friend, Secretary Blinken, is what Mr. Jaishankar tweeted. Detailed discussion on the global COVID challenge, focusing on expanded vaccine production capacity and reliable supply chains. While Secretary Blinken tweeted that the United States government met with Jaishankar to discuss our joint efforts to combat COVID. Now, AIIMS Director Dr Randeep Guleria on Monday warned of the misuse of CT scans and biomarkers by patients having mild COVID symptoms and said that the overuse of CT scans increases exposure to radiation that in turn escalates the risk of cancer.
कई स्टडीज हुई हैं, एक स्टडी हुई है जिन्होंने एसिम्प्टोमेटिक लोगों में सीटी देखा और ये पाया कि 30 से 40% एसिम्प्टोमेटिक लोग जिनको कोई लक्षण नहीं है, सिर्फ उनका कोविड पॉजिटिव है, उनके सीटी में भी कुछ पैचेस आते हैं और वो अपने आप बिना ट्रीटमेंट के खत्म हो जाते हैं। अगर हम एक सीटी कराते हैं, इट इज इक्विवेलेंट टू ऑलमोस्ट 300 to 400 चेस्ट एक्सरेज। और ये भी डेटा है IAEA का भी, इंटरनेशनल एटॉमिक एनर्जी कमीशन का भी डेटा है, जो रेडिएशन प्रोटेक्शन इन मेडिसिन की बात करते हैं, कि बार बार स्पेशली यंगर एज ग्रुप में सीटी कराने से रिस्क ऑफ कैंसर इन लेटर लाइफ इंक्रीजेस। तो आप अपने आप को नुकसान ही ज़्यादा करा रहे हैं जब उसकी ज़रूरत नहीं है, क्योंकि आप अपने आप को रेडिएशन एक्सपोजर कर रहे हैं और उससे बाद में कैंसर होने का चांस बढ़ सकता है।
Well, to talk more about the COVID situation in the country, we're joined by Dr. Marina Sirkar, Director and Head of Pulmonology at the Fortis Hospital in Noida. Dr. Sirkar, thank you so much for sparing your time. And first and foremost, I want to ask you about what Dr. Randeep Guleria said, because this has really created a lot of worry among people. And we do know that ever since, COVID has hit the country, people have been getting CT scans since this last wave, the second wave of COVID, that number has increased. And, now Dr. Guleria saying that it seems that there's a lot of indiscriminate advice being given for CT scans.
Yes, that's correct. Mild cases, those patients being treated at home, there is absolutely no indication for a CT scan. Only seriously ill patients who are admitted in the hospitals, some of them would need CT scans as part of their treatment and as part of deciding how severe the disease is or complications thereof. Mild cases, people running around getting CT is completely unnecessary in terms of both money and radiation that they're getting.
Right, Doctor, though, some people also claim, and again, this is from, viewers and what we've got in response to this news of what Dr. Guleria said, is that many times, even in what is thought to be a mild case, it's only in CT scans that, the level of perhaps pneumonia or some sort of lung patches have been revealed, and they feel that, this is something that would help them fight the disease better. What would you say to that?
I definitely don't think so. No matter what the CT scan is showing, what matters is what is the oxygen level, what is the condition of the patient, whether the patient is comfortable or running hectic temperature, is he breathless, and of course, most important, like I said, oxygen levels. So doing a CT scan in mild cases is completely not necessary. It just scares the hell out of people and then causes unnecessary anxiety.
We're also joined by Dr. Vijaya Sures, interventional cardiologist, Jupiter Hospital. Thank you so much for joining us, Doctor. I'd like to get your view as well on what Dr. Guleria said yesterday regarding CT scans and, how they're being overused currently in the country, and people are getting too many CT scans. Even mild cases are getting CT scans, and many a time, even those who have recovered are advised to go ahead and get a CT scan by their doctors.
See, I missed out on the first part. I got connected late. But the information about CT scan, Dr. Guleria must have actually shared with you. Yes. Most of the cases, they turn out to be RT-PCR negative. But they have classical manifestations of this kind of viral illness. So only diagnostic test which can give you a clue about the diagnosis about the viral illness, where the specific densities are seen in the lung, is by HRCT. He must have told you HRCT is being overused or doctors are overusing, but there is no other modality by which we can diagnose. But doing HRCT in a person multiple times can irradiate a person and expose the person to risk of radiation. Right, but so this does not...
So, Dr. Vijay, what you're saying is that in certain cases when people are testing negative for COVID, but they have all the symptoms, those are the, those few cases are the ones where you feel there is a need to get a CT scan.
Absolutely. This is one of the best tests to diagnose proper COVID illness, because you see that many patients who come negative, they have classical manifestation, and the HRCT only gives you information about the ground glass opacities which are classical about the COVID illness.
All right. So, I mean, for laymen, this is all very confusing, in terms of the indiscriminate use of CT scans is what Dr. Guleria has really cited. And Dr. Sirkar, so coming back to the indiscriminate use, yes, in some cases you do require CT scans, but you're saying that many doctors across the country and, in towns and cities perhaps are, advising people to go ahead even when they don't need it.
I think a lot of people are just reading WhatsApp and going and getting their CT scans done. So, if the patient is stable and they have mild symptoms, based on the fact that there is raging pandemic going around us, based on symptoms alone, we can treat patients even while waiting for RT-PCR. RT-PCR, we all know, may be negative in as much as 30% to 35%. But the symptoms are classical, and we know there is pandemic going around every house, and sometimes one patient in the household is positive and the rest of them have symptomatic but RT-PCR negative. So it's common sense to treat them. We don't need a CT scan. The CT scans may be necessary for seriously ill patients, and we do use them in the hospitals. And
right, so Dr. Guleria's message, you think, is more to doctors across the country rather than people, and you're absolutely right. Some people, even I know people who they've just tested for positive for COVID and they're going ahead and getting a CT scan, and that is something that you're saying is just not advised. So Dr. Guleria's message also to doctors across the country.
Yes, certain amount of guidance is needed because the number of patients of COVID or COVID-like symptoms is so high that they are accessing everybody. It's not necessarily that only a pulmonologist or an internist is seeing. So every doctor is being asked to treat. And so clear guidelines as to when a CT scan is needed, just like guidelines are there for treatment, is definitely useful. The unnecessary CT scans is not adding anything except increasing anxiety of the patient. And mind you, this also putting pressures on the CT scan centers or CT scan machines.
Sure, and people gathering there, because we do know CT scans take time, and very often people just gather in those waiting rooms, and they expose others as well. Dr. Vijay, also I think what worries a lot of people is how quickly this illness is escalating in this second wave, because people seem to have got a mild illness, but suddenly their oxygen levels plummet and they're breathless, and then the rush for hospital, and that is also something that is worrying people and perhaps is leading to more of these CT scans being advised.
See, basically, yes, this viral...
A minute, Dr. Sirkar, let Dr. Vijay answer that question. Yes, go ahead.
Yeah, sorry.
This second wave is not very lethal, but rapid change in the clinical picture is happening. There is acute viremia and clinical presentation, but people are not getting that kind of classical COVID pneumonia or a dangerous affection of the pulmonary parenchyma, or lung affection is not that danger. So it is type of a common cold we should not be worried about, but those who become breathless should get evaluated, should see a physician. Those who become very breathless and their saturation drops below 90 to 93%, these are the ones, even if you may not do RT-PCR, you should get a CT scan done, HRCT done, and get a clinical judgment from your physician.
Right. Dr. Sirkar, your view on this, how it's escalating so fast in some of the cases that we're seeing, and that is why I think people are very frightened, because, suddenly to be in this situation where you have to rush your patient to the hospital because they're just breathless and running out of air.
I think the answer is to meticulously keep charts of their oxygen levels at home, even every 4 hourly or at least 4 times a day. And if there is a trend of dropping in oxygen, or there is emergence of breathlessness, or the person is starts feeling unwell, severely unwell, I'm not saying body ache and stuff, then they should seek medical attention rather than treat themselves by doing a CT scan. Anyway, CT scan is just an image. So imaging is not going to treat the patient. Neither is the extent of lesions on the CT scan automatically tell us how sick the patient is. So this is a myth. It can give us an impression as to how much of the area of the lungs are involved. So the key is simple clinical thing like measuring the oxygen levels meticulously, keeping a chart, and as soon as the oxygen levels seem to be going south, they need to seek access to medical care quickly. Now, there is no need to be scared, for everybody to be scared, which a large majority of the patients would have mild disease and can be managed at home. But there is a subset which needs hospital care, and they need to be, all patients, even those with mild, need to be vigilant so that they don't reach the hospital late. That's it. I personally don't think CT scan is going to change that at all.
All right, we'll have to leave it there. Thank you so much, Dr. Sirkar and Dr. Vijaya Sures, for joining us this morning on the show.
Thank you.
Thank you.
Thank you so much.
With that, time for us to slip into a short break. We'll get you more news on the other side. Stay with us. Welcome back. India is one of the major contributors in the global COVID numbers. The WHO chief has said that more cases of COVID have been reported globally in the past 2 weeks than during the first 6 months of the pandemic.
More cases of COVID-19 have been reported globally in the past 2 weeks than during the first 6 months of the pandemic. India and Brazil account for more than half of last week's cases. But there are many other countries all over the world that face a very fragile situation.
Now, a look at the vaccine situation across the country, and even as the next phase of vaccinations has begun for those between the ages of 18 to 44, a big challenge is that vaccine shortages are being faced by many states, and a bigger challenge is the second vaccine dose, which has become a huge problem for several lakh people. At least 42 lakh who got Covishield and 6 lakh Covaxin just in Telangana. No vaccines are available for with any of the private players. Well, to talk more about this, we're joined by Dr. Sheetal Chawla, who is facing this particular challenge. Dr. Chawla, thank you so much for speaking to us. And the problem is that people are supposed to get their second dose of Covaxin within, a 4 weeks' time. And now you're facing a problem in which you're not getting that dose anywhere.
Yes. See, actually, my husband was due for his second dose of Covaxin on the 21st. But since we had an active case at home, my son had contracted COVID, we had to wait till 28th. So all of us test negative. So from 29th, every day we've been trying to locate every private hospital. Nobody has any vaccines. In fact, we were told to try it through the COVID app. Even the COVID app is showing no center available for vaccination. And the efficacy of Covaxin is between 4 and 6 weeks if the second dose is taken. So my husband is due for a second dose by the 5th of May. If this continues, I don't know what, situation we're left in, because beyond 5th, I wonder how much the efficacy of the second dose would even play.
Is there any indication when, fresh doses, and we do know this is a problem, and it's not just there in Hyderabad, it's being faced by many people, because now with the phases opening up and with the ages of 18 to 44 also being, eligible for the vaccine, a lot of people over the age of 45 are now facing this same problem. And while for Covishield, we do know that, you can extend it between 8 to 12 weeks difference between the doses. Covaxin is the challenge. So what do you know about the efficacy if you miss that window for the second dose?
That's exactly what I'm saying. There's a lot of concern and anxiety among a lot of patients also who keep calling me because they're due for the second dose for their parents. So ironically, what people are doing is in such a high COVID surge also, they're going hospital to hospital and exposing themselves to the COVID environment. So which is not doing good to anybody. So, what we would like to see is at least some kind of information when we would be able to get our second doses. We've been told that 45 and above can log in through the COVID app and book, but the slots are so limited. So sometimes you don't even see any slot, or if anyone sees, it's like, it gets over in a few minutes. So I don't know how they are going to go about doing this, but if you've given somebody a first dose, ideally you have to see that they get their second dose too.
Right,
and
absolutely.
Especially when it comes to Covaxin.
It's important to ensure that, people are completely protected from COVID and receive both doses.
Dose itself is not sufficient. Yes. Because you ideally attained immunity only after your second dose of the vaccine. So if you have started an immunization program, I think one needs to see that everyone is given priority, especially over 45, and given their second dose. And also it's high time the youth started getting, their vaccinations, because they are getting affected in the second wave. My own son is around 17 and a half and he has contracted COVID.
Well, that's a whole other issue I suppose that we'd have to discuss. But yes, a very important point, and this again being faced by many people, the challenge in getting the second dose of the vaccine, especially for Covaxin. Thank you so much, Dr. Sheetal Chawla, for speaking to us.